Hello everyone, how are you? My name is Sarah Agil. I'm an occupational therapist and today we'll be discussing range of motion and manual muscle testing. So first things first, range of motion. What is range of motion? Range of motion is a assessment or a measurement that we can measure the degree of movement at a specific joint. The instrument we're using is Goniometer. We have for a Goniometer for a big joints and for the smaller joints. I will include some pictures for Goniometer. Also, there's a trick of how to measure the joints without using Goniometer if you don't have it, but I guess it only works for the big joints. So, first things first, what are the types of range of motion? We have three types. We have the passive range of motion, which the patient wouldn't be able to move his joint by himself, so we need to move it for him in order to measure the degree of the joint and the flexibility. We have the active range of motion, which the patient can move his joints independently without the help of an outer source. The third type is the active assistive range of motion. I guess you can know what is the movement from the name. It's an active assistive, so the patient would be able to do half of the movement and the therapist will help him with the rest of the movement. So as I said, I'm going to show you how to measure the joint without using the Goniometer if you don't have one, like in my case now. I'm going to use my thumb and my little finger to assess the joint. So for example, let's say we need to assess the elbow flexion movement of the hand. I'm going to ask the patient to extend his arm. I'm gonna place my thumb here and my little finger here. I'm gonna work as a Goniometer, so this is the 180 degree. And then if the patient was able to flex it until the ring finger, so it is 145 degree. If he's able to flex it until the middle finger, it is 90 degree. If he's able to flex it to my index finger, it's 45 degree, and vice versa. If I want the patient to extend his elbow and measure the joint movement, I'm gonna ask him to flex his arm, and then I'm gonna place my thumb and my little finger like this. I'm gonna ask him to extend it, so if he's able to extend until my index finger, it's 45 degree, my little finger is 90 degree, my ring finger is almost 145 degree, and my little finger is the 180 degree, which is the norm. The main thing is you need to assess both sides, not only the weaker side. Why? Because we need to see the normal of the joint movement. Most importantly, that we need to actually assess in the initial evaluation, during the treatment, and in the end, in the discharge. Why? Actually, to see the effectiveness and the improvement of the patient, the effectiveness of your treatment plan and the improvement of the patient, and it will help you to document it to see the improvement of the patient. So the second thing we're going to talk about in this video is the manual muscle testing. First of all, what is the manual muscle testing? It's a standardized assessment that assesses the strength and the function of a specific muscle. You will do it after you're assessing the range of motion. The steps of doing the MMT: first, of course, you're going to assess the range of motion actively and then passively. The second thing, you will explain it to the patient. For example, I'm going to do a test now that will evaluate the strength of your muscle, of the specific muscle. You're going to demonstrate it to them, how you're going to do it. The fourth step is you're going to position the limb where it will be tested against gravity. For example, if you want to test, let's say, the flexion of the elbow, so you're going to position it like this, an extension, and then you will apply some resistance so he will able to flex it against gravity. The fifth one is that the patient have actually to move it the full range of motion as much as possible. And always you have to actually check both sides, not only the weaker side or the injured side. So what are the grades of manual muscle testing? I'm gonna start with 5, which is the normal one, which is full range of motion. So again, let's say joint joint flexion. So number 5 or grade 5 is actually full range of motion against gravity. So we're going to apply resistance and the patient still will be able to actually flex it full range of motion. Grade number 4, you're also going to apply some resistance, but he will able to only move it halfway through, not all the way through. This is number 4. Number 3, he will able to move it full range of motion, but without any resistance from the therapist. Grade number 2, he will able to actually do half range of motion with gravity. I feel some contractions, but there is no movement in grade number. As I mentioned earlier, you need to check both sides, both in range of motion and manual muscle testing. What is the goal of doing it? As we mentioned, is to assess the improvement of your treatment plan and to see the improvement of the patients within the days and weeks of the treatment, to see if there is any improvement. Thank you so much for watching. If you have any question, we are more happy to answer them. And please, if you have any suggestions for other videos, comment below, please. Thank you so much for watching. See you again. See you in another video. Muscle testing. So, first of all,